Hypertension is regarded as one of the world's most silent killers, as even seemingly healthy people may be hypertensive and not realize it. Recent studies have shown that high blood pressure associated with hypertension is more prevalent among Black people. As a result, medical experts have recommended frequent blood pressure checks to ensure people remain healthy and free from hypertension. I think the question we would ask you is, when last did you check your blood pressure? Very, very important. I should ask you, Salge, when?
About 3 weeks ago.
3 weeks ago. Okay, yeah. Mine was last week. Very important. Now, News Central's Ben Akede tells us more about hypertension in this report. Let's take a look.
According to statistics from the Center for Disease Control, over 1 billion people are living with high blood pressure worldwide, most of whom are Black. According to World Health Organization, hypertension is a condition in which the blood vessels have persistently raised pressure. This medical condition can increase the risk of heart, brain, kidney, and other diseases.
There are two values that we look at when we're measuring the blood pressure. There's the systolic blood pressure and there is diastolic blood pressure. The systolic pressure is the pressure when the heart beats, and the diastolic is when the heart is in a relaxed state. So, and that's why we have two values. There's one up and there's one down. And the normal blood pressure range, we generally say 120 over 80.
There used to be an erroneous belief that hypertension was only associated with the elderly. But these days, people in their 30s and 40s are being diagnosed with high blood pressure, yet not many take this silent killer as seriously as should be taken.
I don't have any problem. Even if I have, I manage my problem, so I don't think it can result to having blood pressure.
I check my blood pressure every 3 months, sometimes before 3 months. But I advise that everybody should check every month.
I can't actually remember exactly when I did this because I hardly go to hospital.
So the more you go there, the more you will be provoked. At times it will come back to 140, at times you go back to 170. Next time it will come to normal. So frequently if you go, it will give you different positions.
Fortunately, hypertension can be prevented and managed by checking the blood pressure regularly and through treatment. World Hypertension Day is observed every year on May 17th in a bid to increase awareness of hypertension and educate people about the problems caused due to hypertension. The theme for the year 2022 is Measure Your Blood Pressure Accurately, Control It, Live Longer.
From 40 years and above, you need to regularly check your blood pressure, check your blood sugar. But for some people less than 40 years, like 30, because of some conditions they may have, they are predisposed to having also blood pressure. So once you have, we generally advise that once you have any signs, headache, dizziness, and things like that, you're not sure, visit the hospital and let the doctor properly examine you.
According to Statista.com, the average life expectancy at birth for those born in 2021 across Africa was 63 years for males and 66 years for females. If this is to improve at any time soon, Africans will need to pay more attention to their blood pressure and their health in general. Bernard Akede, News Central, Lagos.
A very interesting report by Bernard Akede, and of course a very interesting conversation. We're going to bring Joe in because we live in a society where there's so much pressure. Just living in Lagos or living in Nigeria and going through the stories that we have to do with every single day as Nigerians, and of course other places in Africa. Joe, is blood pressure something that bothers you, that you check often, weekly, monthly maybe?
Good question. Good question, Asage. Just about 2 weeks ago, we had a medical professional who joined us here on Breakfast Central, and she made mention of the reason why we need to check our blood pressure regularly. She talked about how a walk-in corpse, like she put it that way on the show, came into her hospital. He was just 19 years of age, 19, and his blood was reading I think about 190 to 200 and something. Yeah, it was really high. She said it was really high, and they kept shouting out, what's wrong with you? So with that report, it calls for all of us to check. I mean, I recently got the equipment. I checked mine on Saturday. Yes, I did. And I'm looking to check it all over again because Lagos is stressful.
Not just Lagos, I think particularly after every football match by your favorite...
Arsenal fans.
You had to go there, right? But to be honest, it's something we really need
Yeah.
to do. It's something that's very important. In this part of Africa, most times we feel, like you heard in the report, someone said, I don't fall sick. We hear people say that, I don't fall sick, so I don't need to go to the hospital. It's something we really, really need to do. The more you age, the more you live in a very busy area like Lagos, other country, other African countries as well, you need to ensure that you check your blood pressure.
I think
that's it.
It's also important to just quickly mention, that I don't think it's expensive. You don't get to pay for this. You can walk into any pharmacy around where you live and ask them to check your blood pressure. I don't think, at least all the pharmacies that I've been to that I've had my blood pressure checked, I didn't get to pay anything.
Yes.
It was a free check, and so this, I believe, should be public information. Walk into any pharmacy. If you can't go all the way to the hospital, walk into any pharmacy, ask them that, to get your blood pressure checked. I don't think any reasonable pharmacy would charge you for that.
Yeah.
That's
And
true.
also there are certain risk factors we must consider. I mean, for a lot of us, our parents have had history of high blood pressure. So if you have a mother or a father who has had high blood pressure, I think it just makes sense that you take it more personally. And also with our diet, Joe and Osaugi, the kind of things that we eat these days, our cholesterol level keeps rising. It's just so much, but it's important.
I agree.
Thank you for the
Exercise
reminder.
as well, very key.
I will go check my blood pressure today. So
Please,
I'm
guys,
sure
both
I
of you
will
need to.
also.
You have to. You need to check it.